So vaccine basics and drug dosages. And this requires a little bit of math, but it's easy. So all modern Western medicine is based on chemically derived pharmaceutical medications that are dosed out by body weight. So let's start with an example of a college kid. You might have a 300-pound offensive lineman on the football team, or a 100-pound female gymnast, or a 100-pound scrawny kid. So that's potentially a threefold difference. 300 pounds to 100 pounds is a factor of 3. So when it comes to giving them antibiotics and medications and stuff, they might have a difference of 3 times more or less of one medication between one person or the other. Now, usually in human medicine, even though I say that as an example, they usually give them 50% more or maybe twice as much. They don't usually factor it out exactly like that. But I say that because in dogs, it's so much different because of human intervention. So you may have a 200-pound Mastiff or 200-pound Great Dane versus a 5-pound teacup Yorkie or 5-pound Chihuahua. You see, humans of a same age range are usually a similar size. There may be a factor of 3. And the opposite of that is horses. Most horses are approximately 1,000 pounds. Some may be 900, some may be 1,100, but they're approximately 1,000 pounds. And we don't have a scale out in the pasture to weigh the horses anyway. So horses basically get medications based on a 1,000-pound dose because horses are all approximately the same size. But in dogs, there's a much wider range, as I said. It could be a factor of 40. 200 pounds versus 5 pounds is a factor of 40. So what's that mean? Let's talk about the common drugs that dogs take that people know about. Like Rimadyl was the brand name of carprofen, which is an anti-inflammatory drug that some people hate, but it's common enough that people know what it is. So carprofen, anything that ends in profen, like ibuprofen, is an anti-inflammatory. And then there's actual pain medicines, or more of your opioids that actually block the pain signal. That's your morphine and codeine and OxyContin and fentanyl, heroin. Then there's anesthesia drugs for knocking you out, to put you to sleep, to do a surgical procedure, antibiotics, anti-seizure medications, blood pressure medications, all medications. In dogs, there's typically a 40 times difference in how much you give one dog versus another. So what I mean is, if you give a 5-pound dose of any of those things I mentioned to a 200-pound dog, it's not going to do anything, right? If you give a 200-pound dog dose to a 5-pound dog, it'll literally kill that dog, okay? Even elsewhere, chemicals, glyphosate, the stuff we spray on crop fields and yards, those are calculated based on size and weight, like how many crops per acre, the density of the crops in the field, how big the field is. They don't just dump the same amount of chemical on any field. They calculate the concentration of the chemical based on how much crop is in that field. But not vaccines. This is the only place in modern Western medicine and modern agricultural science even, vaccines is the only place where it's one size fits all. But the 200-pound dog has 40 times as many immune system cells and 40 times as much physical space to absorb and deal with that 1 milliliter vaccine. Vaccines for dogs anyway come in 1 milliliter doses. It's often 1 milliliter for humans and horses. Sometimes horses get 2 milliliters, but most of them are 1 milliliter. So you can see that the 200-pound dog has a lot more tissue and blood and immune system to deal with that 1 milliliter vaccine compared to the 5-pound Chihuahua. So most people can see that from one end, but they don't see it from the other end. What I mean is, you may be able to see that the 200-pound dog, if he gets 1 milliliter of vaccine, then the 5-pound dog should get a few little drips of the vaccine, right? But we don't ever look at it from the opposite way, and I think that might give you a little bit better perspective here. This is why I'm doing this video right now. So the opposite, if the 5-pound dog gets 1 milliliter, then why do we not give the 200-pound dog 40 milliliters? Because that would be the fair 1-to-1 ratio concentration. Why do we not give the 200-pound dog 40 milliliters of vaccine? Because that's exactly what we're doing when we give the 5-pound dog 1 milliliter of vaccine, okay? I've spoken about many other aspects of vaccines in other videos and in my book, and this and those other factors I've talked about, nothing about vaccines makes sense. More about this is in my book, and if you need to talk to me about these things, I do offer phone consultations. Use the QR code on the screen. Take to my website. From there you can schedule a consultation or click the link to go directly to buy my book on Amazon. Thank you.